Hey everyone, I am presenting this PowerPoint on C-sections today. I just want to get the information out there. You can let this be a guide. The Natal Network wants to provide accurate educational information. Any information shared is not meant to replace the care that you receive from your physician. This is just a guide, an at home guide for people who just are generally curious. It can be used for students as well. If you are a birth worker, it's nice to have some evidence based facts so you can use it for that as well. So, here is the intro slide on cesarean sections. So, this PowerPoint will cover what a C section is, the indications of a C section. I'll have some surgical diagrams or just animations. It will not be live action. And then I'll kind of just review what's going on in each section. It'll also cover what the risk associated with C-sections are. And then we'll look at the global impact of C-sections as well. So we'll just kind of look at some of the facts globally. So our first slide, what is a C-section and what to expect? So a C-section is an obstetrical surgery performed by a doctor. So you see doctor is in bold and underlined. I want to emphasize that nurse practitioners do not perform C-sections. Okay? Physician assistants do not perform C-sections. Okay? This procedure is done by a trained OB. Okay? No one else can do it. All right? So if you're talking to someone or want some advice about something regarding the procedure, the best people to talk to are your providers. Usually, you are able to meet with your clinical team and tour the hospital before you have your procedure, whether it's a surgery or a vaginal birth. Okay, so this is actually a service that Natal Network can help assist with, making sure that you are comfortable and you have had the opportunity to meet your surgical team and to discuss the surgery that you may have to have. So this PowerPoint will kind of give you some information and help you understand what questions to ask, okay? So yeah, it must be performed by a doctor. So they make an incision into the lower abdomen, and then they also make an incision into the uterus. So as we know, the uterus is what's holding baby, and that is where the baby will be pulled out of for delivery. Okay. So during the diagram, you'll see all the layers that we go through. It's not just a one incision into the abdomen, then one incision into the uterus. There are more layers within the skin that we're going to review. Okay. Now, ideally, vaginal birth is preferred because it is less invasive and there's far less risk. Okay. But C-section can be a life-saving intervention for mom and for baby. Okay. Now, typically a C-section is not requested. I have the stats on one of the slides, but I think only about 2.5 or 2.9% of C-sections are optional. Okay, so the ACOG recommends against doing a C-section unless medically necessary. So if the fear is pain, like birthing pain, then the patient should be educated. Also, it should not be just because you want to have a baby on a certain day. Okay? We're doing a big task. Patience is a virtue, okay? And you don't want to put yourself through any unnecessary surgery because you just never know what can happen to you or to baby. Okay? So yes, when a woman wants to request a C-section, it is best. Matter of fact, it is actually required that, at least in the United States, that she is educated. Okay. Okay. So when you're about to actually have one, and this is with labor and delivery vaginally or going through labor with the C-section, you always will have some IVs placed for some fluids, okay? That is normal, okay? Whenever you're going to have any type of surgery done or any type of big task when you go into the hospital, they're going to give you an IV line. That is for your protection in case something happens. They have immediate access to your veins, okay? So yeah, you'll be given some hydration fluids as well as any other fluids or medications that can be necessary, okay? Then medication for your pain, you will receive an epidural or a spinal block. So usually if you are not expecting to have a C-section, but you want an epidural, you'll receive an epidural and they can go ahead and still do the C-section with the epidural. But if you are not having an epidural and they say, hey, we got to do a C-section or, just for whatever reason, then they'll put a spinal block in. Essentially, they're doing the same thing. They both will get the job done. You'll still have an anesthesiology team come in and get the medicine set up for you and, put the materials in your back, okay? Also, a catheter will be placed into your urethra to assist with keeping your bladder empty to reduce risk of injury to your bladder. So a catheter is just like a small tube that goes into the urethra. It will drain the urine off. So when you're going to have a surgery in your abdomen, remember your uterus and your abdomen are very close proximity to each other. So you want to keep the bladder as small as possible to reduce the risk of any injury to it, okay? So next slide just goes over some indications of why a person would need a C-section. So labor not progressing. This is when women just are not hitting the 10 centimeters. Remember, 10 centimeters is what is required to push the baby out. That's how much space the cervix has to open, okay? Has to dilate too. History of previous C-section. So a lot of time when people have C-sections, they end up having some scar tissue on the uterus. So this can actually rupture during your next labor. So that is one of the concerns that you and your physician may have, although VBACs are possible. Compressed umbilical cord, abnormal fetal heart rate. This is usually when baby is just not tolerating labor well. So that means their heart rate is either usually way too fast or way too low. Usually while mom is pushing, you'll see the baby's heart rate just going all over the place, okay? Now, this indication varies per provider because you have some providers that will say, hey, that's normal. That's a common thing. Baby's okay. Then you have some that don't waste any time. So it's important to be able to advocate for what you want. And that is something Natal Network does as well, which is one of the reasons why I like to make sure we have these educations provided, because you want to make sure that mom is not having to go into a C-section that she's not really comfortable with. These days, you can have a more gentle C-section. They do have more of a family-centered C-section now, which you can request. What that means is now instead of it just being a room with just mom laid on the table and her surgical team, you can actually have maybe more family oriented. So now they will let a person back, usually daddy or whoever's there. So, and they can maybe put in a request of having some aromatherapy, some candles, some dim lights, and some music playing. This is an option. So please do not be afraid to ask that they do more of a patient-centered, gentle C-section. It does not have to be a horrible experience, okay? Everything I just mentioned is welcome, okay? Another reason is breech position. This is when the baby did not turn properly, being head first, okay? So they have some positions that can assist. If you have an experienced doula, we can assist with that as well, helping get baby to turn. Now, usually this is something that we want to try before you go into labor. But if baby's bottom is at the opening of the cervix instead of baby's head, this is another indication for a C-section. Okay, just because when baby's head hits that cervix, it definitely contributes to how mom is able to push a little bit more easily. A breech birth is not considered to be an easy task, okay? And another one would be active genital herpes. So this one is like one of the most preventable ones. Typically, when you were seen by a care provider and you have a history of genital herpes, they will bring you in around 36 or 37 weeks and begin antiviral treatment. This is to prevent the spread of the virus to baby. So a lot of times what we'll see, if mom is not treated and she lets the baby passes through the birth canal, the baby will get the virus in the baby's eyes. And we do not want that. So to prevent that now, C-section is an option. It is a lot easier just to take the antiviral medication. So for anyone watching, if you know you have any sort of active viruses, please be sure to be seen by a healthcare provider and get treatment, okay? Prenatal care is essential. All right, let's continue. So these are some of the associated risks that come with C-sections. Now, on that first slide where we talked about, oh goodness, I lost my train of thought. Sorry. Well, no, actually on the last slide when we talked about it was the first slide. Sorry, guys. On the first slide, we talked about having an elective C-section where I made that mention. These are the associated risks that would need to be discussed with patient before allowing them to make that big decision. Okay? So, take a look over that list. So, placenta previa, placenta acretia, infection during the healing process, gravid hysterectomy, delayed establishment of breastfeeding, delayed skin-to-skin contact, and slower recovery. If you guys would like more information on those, you can actually send me an email or just comment below the video, okay? And we will go into more detail about some of these. Maybe I'll do like a video for these by themselves, okay? And let's keep going. So on this slide is going to walk you through what a C-section delivery consists of. So as you can see, there are little squares and rectangles on this, and they're in numerical order. So we will start with number 1, and I will explain to you what is going on in that section. So, as you can see, number 1 has a nice rectangular box over the lower abdomen of a woman who, when you see her belly is inflated, so she is pregnant and where the uterus is located. Note that the line is not up on the belly button. It is not over. This slide is going to walk you through what a C-section delivery consists of. So as you can see, there are little squares and rectangles on this, and they're in numerical order. So we will start with number 1, and I will explain to you what is going on in that section. So, as you can see, number 1 has a nice rectangular box over the lower abdomen of a woman who, when you see her belly is inflated, so she is pregnant and preparing to undergo a C-section. Now note the blue dashed lines that you see are across the lower abdomen where the uterus is located. Note that the line is not up on the belly button. It is not over her private area, the mons pubis. It is over top of the area where the uterus is located. So I'm going to use some terms here just for educational purposes that you guys can feel free to comment. You can Google them. But just for more education for all of us and for those who actually want to know more technical terms, I will be using a language that's not as common, as well as giving the explanation for most of it. So, section 1 is the suprasymphysial transverse incision. So that is just a type of incision they are doing over the anterior abdomen and the uterine fundus. So uterine fundus, guys, if you are a woman, I would recommend that you look up your uterine fundus. You want to understand your body and know what these things look like. So they're going to make a cut across that spot right there. Okay. So if we go down to picture number 2, you will see where they're actually making that sharp, blunt dissection of the patient. Ooh, excuse me. Oh, sorry, I sneezed. So, if we go back to section 2, you will see where they are making the dissection into the patient, and it reads adipose tissue. So, adipose tissue just means fat. Fatty tissue, that is the subcutaneous area. So, subcutaneous means pretty much fat. Which means we are not into the muscle yet. So if you go down to number 3, this is where it says fascia. That fascia pretty much means muscle. So this is when we're going beyond just the fatty sub-Q layer of skin, and we are, under the skin, and we are getting into the actual muscle. So guys, there are some layers into this. And then if you look at number 4, you will see the surgeon beginning to separate the muscles and the fatty layers with their fingers a little bit. You got to get a little bit of a little tug going in that picture. Now, remember that the woman she does have medication. She does have some sort of epidural or spinal block, depending on if this was an emergency C-section or if it was a planned C-section. Sometimes that can determine what type of pain management you get or numbing agent. So, back to section 4. So you see they're separating the abdominal and rectal muscles. The rectal muscles of the abdomen. And they are using what you call blunt finger traction. Okay. So then we will go down to number 5. Number 5, you see there are more than one set of hands on mom's stomach in this photo. Okay, so this is where they are doing a little bit of more extension into the incision. So that just means they're stretching it out so that baby can fit. And so they can actually get to the uterus, guys. Remember, we have only gone through the subcut area, which is the fat, and the fascia, which is the muscle. We have not even reached the uterus yet. So picture 6 is where we actually are about to get into the incision across the uterus. So the uterus is what holds the baby. The uterus is your womb. So as you can see, they have done a cut across the uterus. It's called a transverse hysterectomy. So do not confuse that word with hysterectomy. Completely different surgery. But it's nice to learn some of these terms, okay? And then if you look on the side, you see those silver-looking clamp things. They are not clamps, they are retractors. That is what is used to hold the skin back, those layers of skin and fat and muscle back, hold them in place. So in picture number 7, you see the surgeon beginning to stick his fingers kind of into the incision just to kind of expand that uterine cavity so that baby has space to come out. That is what we call lateral digital extension, which is just fancy for expanding out the uterus. And number 8 is when they're showing the surgeon actually going in for the fetal extraction, they are not applying any pressure to the fundus in this photo. So this is not the only picture. If you follow to the next slide, we will continue with number 9. Okay, so let's continue. We're going to do the same thing we did in the previous slide. This is just a continuation of explaining the steps in the cesarean section. Please remember to speak to your doctor, be able to speak with your clinical team, your surgery team, go to the hospital where you'll be having the surgery at and see if you can speak with them about any concerns you may have, but this is just a general guide. So in square number 9, or rectangle number 9, we can see that the surgeon is kind of holding the abdomen taut and another hand is on the placenta. So this process is when they remove the placenta through the hysterotomy. So they do this through controlled traction, which kind of just means gentle tugging and gentle holds, like gripping of the placenta, okay? So this should not be done roughly, despite the fact that you may be numb. Ideally, you are still numb. On rare occasions, some people do begin to feel things because their pain control, their spinal block, or the epidural begins to wear off. Not uncommon for things like this to happen, okay? If that occurs, please speak up because remember, you're in the middle of a surgery and you have not even been sewn up yet, okay? So, yes, they're extracting that placenta. So you usually will have some nurses come in and they'll press on the stomach to kind of help loosen that placenta up from the uterine wall. And then they will pull it through the incision. So then in rectangle 10, they wrote emphasis in there because, they emphasized the word uterus, as you can see is actually typed, because remember, you had an incision made layer by layer. So the main thing to be sewn up now are your sutures going into the actual uterus. So there'll be a continuous closure of the uterus using some corner sutures, just depending on however the surgeon does his surgery. So all surgeons are not created equal. Everybody does things differently, but of course there's still a standard practice. So they will sew up the uterus first, and you still see those retractors are on there holding up the opening. And then when you go to rectangle number 11, the next layer is muscle, known as fascia. So on this one, fascia is actually emphasized. You see the word fascia is written out. And then the last step in rectangle number 12 is where just that top layer of skin is stitched back. So this is the one that causes the scar. So as you can see, they have a small rectangle over the area up under that rectangle. That's the area the scar should be in. So let's just note that the scar is not up on the belly button. It's not in the mid-abdomen. It's not over top of the vagina. It is literally over the mons pubis, okay? So it depends on how well the surgeon does his stitching, okay? With how bad of a scar. It also depends on the type of skin you have. Some people are more prone to scarring than others. Aftercare is a very important step with this. I have had to take care of patients. Mind you guys, I am a nurse. Aside from this, I am a nurse. I've had to take care of patients after their C-section who actually have experienced the wound opening. Okay, it's called descendants, when the wound opens up and they experienced a pretty nasty infection. So I had to go in and clean it out, okay, and put some packing in there until it healed. It is a nasty process and it is painful. So aftercare is a major process with this. You don't want to take your aftercare lightly. So follow the instructions that you were given, okay? And, that is something that Natal Network may be able to assist with checking out, making sure you have a second eye on your wounds, helping you with appointments. We can help with all of that. We do have doulas with nurse backgrounds, me being one of them. So for me, I would be comfortable assisting with that, but then we have some that do not have any clinical background, degrees, or certifications. So when it comes to that, you definitely want to make sure that you have a person who has the correct credentialing, okay? So that concludes the explanation of the cesarean section surgical steps, okay? If you have any questions, please feel free to reach out to me. But of course, always reach out to your care team. Do not be afraid to talk to them. And with any questions or concerns, if you're in the aftercare stage and just watching this, I would tell you to circle back to whoever your wound care team was, okay? Bye-bye. Okay, so we went over that. Now, these are just some fun facts about the global impact of C-sections. So in the United States, 2.5% of C-sections are a maternal request. So by maternal request, it means not medically necessary. 32% of American births are done via C-section. Fun fact for Florida, because I'm in Florida, Florida is 30%. So we want to try to get that down. Continuing on, you guys should look up the rates in your own state for fun, just to kind of see just where you stand. The U.S. Department of Health and Human Services has a goal to decrease C-sections to 23.6%. Okay? So, globally, 21% of births are done via C-section. So, this means all over the world. In Latin America and other Caribbean countries, 43% of births are C-sections. And that is a pretty high number. Now, let's look at how countries differ. I thought this was interesting, so I wanted to include it in the PowerPoint. So, C-sections outnumber vaginal births in the Dominican Republic, Brazil, Cyprus, Egypt, and Turkey. So that means these are the countries where C-sections are used the most, okay? And then in sub-Saharan Africa, the C-section rate is 5%, which raises concerns about accessible healthcare because C-section is not the method that you want to start off with, but it is a medical intervention that can save the baby and the mother. So when numbers are that low, sometimes we wonder, do women have proper access to care? Or could it be a more positive note that they just know what they're doing, that they maybe have some good science behind the way they do birth? Maybe they know how to position moms properly. Maybe they, understand the physiology of things better. Maybe they have certain drinks they use. Maybe they're more physically fit and labor is easier. Maybe they have more of a practice of at-home births, I'm sure, and making baby switch positions in the womb is something that they understand. You want to know why, because truth be told, if the rate is only at 5% and it's not due to lack of proper medical care, then we need to ask them their secrets, right? Okay, so now here is what the WHO recommends. WHO, World Health Organization, this came off their website. The WHO recommends the rate of C-sections be 10 to 15%, and that's globally. Okay, they want it to get down to 10 to 15%. But the WHO also predicts by the year 2030, which is just 5 years from now, C-sections will represent 29% of births. All right, guys, I hope this was helpful for you. Here are the resources I used. Of course, ACOG, AMBOSS, and the WHO. Yeah, so if you have any questions, here is my email address, natalnetworkllc@gmail.com. And there's the website if you ever want more information about the business and what we do and how we do it. And if you want to become a partner of any sort, if you want to keep content like this going, subscribe, share, and of course, thank you for your time.